for having me. I'm CA Oloriegbe, Head of Department, Nursing, Edo College of Nursing Sciences. Okay, we all know that in the healthcare delivery system, there are so many professionals that are working collaboratively to ensure that things are done properly and for us to have our desired goal and objective. Of course, our goals and objective in the healthcare delivery system has to do with caring for patients and ensuring that things are done and are done properly. Patients get well and go back home. Those that don't get well, they die peacefully, so to say. So when we talk about collaborative working or functioning in the hospital, we expect that all the professionals that are involved in healthcare delivery system should work together for the benefit of the patients or the clients. But sometimes conflicts emanate in the course of their professional calling. We all know that in any given situation where people work, there will be conflict because we are coming from diverse environments. We have different categories of persons training. Their training quite different, their background, both home, family background and all the rest. However, conflict is not something that is supposed to be a serious thing, really, because even the tongue and the teeth quarrel, so to say, but they still exist together. So we expect that even if there is conflict amongst the healthcare professionals, that should not jeopardize their major objective of ensuring that things are done properly for the patient to get well and of course everybody work collaboratively for that purpose. The conflict we see these days is quite different from the one we were seeing in those days, because I think it's of a higher dimension now. We hear of people hitting people and all of that, and we begin to wonder why the healthcare delivery system or industry has been turned to boxing ring, where people now fight. And we know that the civil service does not allow all of these things. Yet they continue to exist. So the major conflicts that we have in our system, to me, if you ask me, has to do with mainly doctors, nurses, and we can say that for the pharmacists, it's also a very lower dimension. It's not much. The lab scientists are not involved. The radiographers are not involved. The other healthcare professionals is basically nurses, doctors, more of nurse doctor, because they work together closely, and they are and it's let me say every time it's not a question of the nurse is working and the doctor is not there. So they are working together, and we expect that they should even be closer in the course of their duty. But it is not so. It is not so. We have seen cases where doctors are doing their work or nurses are doing their work. The doctor is supposed to be there, but he's not there. He gives the excuse that he has just finished his night call, and he's so tired he will not be able to come. The nurse will write a series of notes informing him of the need for him to come and see a patient, and of course you will see that they won't come. We have seen cases like that. They won't come, and when they come, eventually the thing is that they raise eyebrow, and some of them will begin to quarrel. They raise issues with the nurse for disturbing them, and some of these things have caused conflicts. Let me talk about the nurse-doctor conflict. Before we go to nurse-patient or patient-nurse-patient doctor, the major thing I see with this conflict has to do with feminism, the feminism in nursing. Most nurses are women and most doctors are males. So there is that superiority complex over inferiority complex. The doctor who is a male sees the nurse who is a female as inferior to him. Because I don't see it as a natural thing. I see it as an individual thing. Because it is said that women have found themselves in the profession that we call men profession. We have women soldiers who are even in Sambisa forest fighting Boko Haram. Yes, we have them. It does not mean that because somebody is a female and that person must be subjugated, that person must be seen to be of weaker sex, and so you can just treat the person the way you like. So oftentimes the conflict we see between the nurse and the doctor is not between the male nurse and the doctor. It's usually between a male doctor and a female nurse. So from there you will not be able to know that this has to do with feminism. The male doctor is seeing the female nurse as somebody that he can subjugate and can control, and he knows that if he does that to a male nurse, the male nurse will not accept it. So often you see the way the conflicts come is such that it has to do with somebody not giving due regard to another person. I'll give you an instance. The nurse does her work. After finishing the work, or let me say, the doctor does his work. Maybe he carries out a procedure in the ward. He leaves the equipment on the patient's table. He leaves the tray or the trolley and refuses to discard his equipment, expecting the nurse to come and discard the equipment he has just used. It happened recently in Ife, Bafumi Oloriegbe Hospital, where a medical doctor used equipment and dumped the equipment on the patients. The clearing of equipment is the duty of the person that carried out the procedure. We have a duty room. The doctor knows the duty room now. Nobody says that the doctor should pick the equipment and wash and no. Simply return the equipment you use now. You have taken a patient's blood pressure, for example. Then the female manometer and the stethoscope you have used. Return this thing to where they are supposed to be. But oftentimes you see that they use and dump them there and expect the nurse to return them, and the nurse will resist. The nurse will tell you, go and please. You don't even need to be told before you know that you are going to return it. You don't need it. You don't need to be told. Just use and return. You know where they are kept. But oftentimes they don't do that. So conflict will emanate. Of course, you see, sometimes the doctor will become violent. He will hit the nurse. Yes, you have seen cases like that. There's another problem has to do with the doctor not satisfied with his order. For example, he said this dressing should be done every day. Maybe because of have shortage of staff these days, the nurse will not carry out that order as it was stated. Daily dressing. The doctor comes in and asks, I said daily dressing, why is it not done the way I have said it? And of course, when the nurse wants to explain, it's another ball game. If you can flare up, oh, you are not following my instruction and all of that. That is that subjugative attitude that I'm talking about. Everybody is getting frustrated. So you see that there is no harmony. Nobody is happy. In a place where there is harmony, you will not see so much of this kind of conflict that we are seeing. There's too much conflict these days because everybody is getting frustrated. That nurses are living in rooms, and of course everywhere is empty, more or less. And the few ones that are there are experiencing serious burnout, in their workplaces, and all these things just people will flare up unnecessarily, and of course there is that conflict, there is that problem. That is the major reason. Well, you see, the way forward in all of this is that we need to remember that we are civil servants, we are workers, especially in government-employed, government-owned facilities. And there are rules, there are extant rules. The extant law says you do not fight. You don't fight. And if we have this at the back of our mind, we will not go into this kind of conflict or fighting. Somebody hitting somebody. You don't really hit in civil service. You don't hit your colleagues. They should know that. Apart from that, they should know or realize the fact that we are all adults.
Yes.
The facility does not. Even if I'm the owner of the facility, it does not mean I should start slapping people all over the place. We should have that kind of mutual respect and be able to contain our anger. Some persons cannot hold their anger. If they don't hit, the anger will not go. It's only after they have exercised or brought out that anger by hitting that they are satisfied that they have done something. No, I don't even feel that there is any need for anybody to start fighting in a workplace, at a workplace. But rather, there are mechanisms that should be put in place to ensure that some of these conflicts are resolved. Yes, because we have disciplinary committees that should be set up in some of these facilities. If it happens, then the two persons are brought before the committee objectively. Because what we see these days is that there is a conflict between the nurse and the doctor, for example, and the committee, the disciplinary committee, have been set up to look into the matter. You see that the disciplinary committee is usually lopsided. They take a kind of position that is not objective, because the members of that panel are mainly doctors. You will not see any nurse as member of the panel. Doctors are the ones there. They will be the one how is it called again now? The judge and the jury. They will accuse you, and they will judge. They will be the one that will judge you. No objectivity in it. They will make up their minds, and some of them will say, "Who are you as a nurse to come and be quarreling or be hitting a medical doctor?" Okay, we know that the nurse is not a doctor. The doctor is not a nurse. But there is need for mutual respect, because both of them are involved in the care of the patient. I'm even aware that even some pharmacists have been assaulted. I want to link it to assault sometimes. When you hit a colleague in your workplace, it's an assault. And sometimes this matter can go beyond the facility setting. If you hit me and I decide not to retaliate, I can go to court. I'll go to court and seek redress if there's evidence, especially these days of CCTV camera, way of phones and all of that. Once it's established that this is what you did, of course we're going for it. Some person will want to seek redress through the legal means. Yes, some people will do that. By the time we begin to do that and people are sanctioned, I think some of these things will reduce, because it's very rampant now. We're very, very rampant. People are penalized. But usually, like I said, it's usually a one-sided verdict or penalty. Usually one-sided, because the people who are adjudicating on the matter are usually the medical doctors. And they sometimes they have that kind of predetermined, they make up their mind that So long as there's a conflict between the doctor and the nurse, and it's established that this person, there was an assault or a case of there somebody hit and this one hit back, then the person that is wrong is the nurse. Yes, the person that is wrong is the nurse. That's always what I've seen in all of these conflicts. The mindset is that the nurse does not have any right to retaliate in cases of physical assault from the medical doctor. If you are a doctor and you hit a nurse, the nurse is expected to cry and keep quiet. It's like father beating a child, and you tell the child that he has no right to cry or whatever. But I've always told my students that if there are two things to it, if you hit a nurse, the way I look at it, if you hit a nurse, it's either the nurse hits you back immediately. The nurse hits you back immediately. That's the end of the matter. If it's established that the doctor was the one that hit first, and the nurse hits back, the case is over. Why is it over? Because the nurse reacted. He or she reacted. It was provoked to react. So you hit and he hits back. It's either you do that or you seek redress. You go to the management. You report the matter through whatever channel. Let it get to the management. If you are not satisfied with the verdict, you go to court. That's it. Once you are not satisfied with the verdict, you know that this person has humiliated you, has done this to you, and the matter was not properly addressed, then you go to court. Court will bring out his own verdict, and the person will pay. You can sue the person for damages. Yes. So once that is done, others will learn. It sounds like deterrent. But the few cases I've seen is that they will give the doctor what is called soft landing. The soft landing is that, oh, you go and apologize. After hitting me, you now come and apologize. That is the highest I've seen. Or when it's so intense, so serious, they will tell you, they will issue a query to the doctor. The doctor will answer the query. They will delay. You know, the more you delay an issue, the more the thing becomes simmers up. At the end of the day, the doctor is asked to apologize. You can apologize in writing or a verbal apology, and that's the end of the case. No proper sanction, no interdiction, no suspension, no even dismissal. Some of these things can result into dismissal, but nothing of such has been done because some persons are emotional. They are emotional and they take side. It's a serious thing, but with time, I think all these things will and don't also forget that the healthcare industry, people are now developing themselves. Before now, nurses and others were seen as underdogs. Now they are not. They are seen as school dropout and all of that, but it's not so these days. People are now saying, I did nursing by choice. I was not forced to it. I liked it, that's why I did nursing. It's not because I'm not qualified to read nursing. And you know, it's the same entry requirement now. And of course, most young nurses you are seeing now are degree holders. And some of these medical doctors, they know that these are degree holders and they exercise caution in the way they interact with them. You understand? So all these things will be a thing of the past through development, through proper training and reforms. You know, the reform I'm talking about now is that, okay, before now, we didn't have degree holders working in the ward as nurses. Today you have so many of them, almost all of them, they have degrees, and some of them are well placed. Before now, there is a level that the nurse will get to, cannot move beyond that level. Now, nurses also rise to level 17. Yes, they rise to level 17. And most of them are on level. During my time when I retired on level 70. Really, I disengaged from level 70. You understand? So these are new trends. Before this time, nurses will not rise above level 40, but doctors will rise to level 60, 70. So even the civil service recognizes the doctors more than the nurses in their career progression. But now it is no longer so, because you have so many of them who are degree holders and they rise to the peak of their career. So there is that mutual respect. If the doctor knows that you are a level 17 nurse and he is also probably on level 17, he gives you that respect. But some of the problems we see is usually between the senior person to the junior person. So once they know that this person is a very senior person, they give you that respect. Oh, they know that this person has read so much, they give you that respect. After pharmacy these days is different. Yes, doctor of pharmacy. Why will the doctor not respect you? He's going to respect you, he's going to give you that respect. If the nurse also can rise above what it is now, all these things will be a thing of the past, and we begin to practice like we practice abroad. We don't hear of things like this. So in those days when we were students, you see doctors who are in the theater doing surgery or operation, they start flinging forceps and all of that on nurses. This is not what I asked you to give. Why are you bringing this? They fling, but they won't do that this time around because they have to exercise caution. But if you fling an instrument on a nurse, the nurse can fling it back at you. And yeah, of course, if you want to fight in the theater on a patient that you are operating on, then go ahead and do that. So that we know. So I think it's worrisome, but I think it is being gradually addressed. I also want to state that the doctors who are major culprits in all of this should also undertake courses in humanities. You know, there are courses that you take that will at least address certain moral issues in the university. Psychology, you have a way of interacting with people, because you see that the doctor is more or less, I'm not trying to generalize, their level of interaction with the public is very poor. It's based on the fact that they have not been properly groomed in humanities. When we were in UI those days, we did a lot of courses in sociology, psychology, and all of that. We even went to education. And we were trying to find out why is it that the medical students are not exposed to these courses. And they said that, well, they were invited, they were supposed to have come down to the department or the faculty to take such courses, but they refused and said that the lecturers must come to the college to teach them. That type of, I don't know whether to call it pride now, and because there is nothing you do in the university that will not benefit you. When I was in UI, I was going to take courses in classics. I just wanted to be in class and know what classics is all about. Because we're hearing of classics, you especially as BA classics. I went 2 weeks. I was attending classes in the classes department. I was attending lectures there. If I don't have morning lectures, I will just go there and sit down and teach, and I will hear some of those Greek languages and all of this. So you doing that, if the medical students can be exposed to some of these humanities, I think it will simmer down this conflict that we are having. And of course, if they also agree that the healthcare delivery system, especially the hospital system, is not the prerogative of the medical doctors, there are several other professionals, they will not do what they are doing. The medical doctor is the CMD, the medical doctor, they are the consultants, they are in charge of this, they are everywhere. Leave this hospital setting to be headed by hospital administrators. If we can really restructure the system, these conflicts will reduce. But because the doctors are in charge, they are the alpha and omega. Once there's a conflict affecting any of them, they team up together, and of course they take a stance. They become subjective. They are no longer objective. And their own is that why should the doctor be slapped if the doctor slaps somebody else? Don't you know that it's a medical doctor? That kind of feeling, and it's not a very good one. It's a major problem in the healthcare.